want to hear it again. So I have the recording going now. We've started the recording and we can begin. So my goal in planning this webinar with you, tests as a tool for tracking your health, is to let you know how important tests are. I often get people sending me test reports every day in my email, and I do want to say that I can't open all these test reports obviously because I have my regular work, I have my consultations, and I want to share with you that we can't even do this without all the information. So as a disclaimer, I want to say that this webinar will be an overview of the importance of tests and what each one means. It cannot replace a consultation with a doctor because a doctor always looks at the symptoms first, even before they look at the tests. When we do SHARAN consultations, we have a patient record form with all the important symptoms, and I never look at the test before I understand what the patient is suffering from. Most tests should not be interpreted in isolation. And reports often mention this. So if you have your reports here, reports will mention sometimes that correlate this with clinical conditions. If just the reports could give you an indication of what to do, they would be writing it there. But they cannot because it has to be correlated with the symptoms, and the symptoms are more important than the reports. For example, you'll start feeling symptoms even before the reports show some abnormality, but nowadays many of us don't recognize this. For example, if we're feeling tired, it could be because your hemoglobin is low, it could be because your B12 is low, it could be because of a variety of other things. So we feel the tiredness before it records on the test, but sometimes we don't recognize that tiredness is a symptom and the tests highlight that something is wrong. But people often avoid tests. I always say that, you know, in my seminars that tests are so very important. Please go out and do your tests, and especially your vitamin B12 and D tests. But people often avoid tests because we don't understand the importance of tests. So I want to make you understand this today. Or we feel that we're living so healthy, so why is a test needed? So I want to explain what is the meaning of some of these tests today. Also, people think that they're an expensive waste of money. And you know, I'm with you here on this. I do think that they're expensive, and not only are they expensive, but they hurt. You know, who likes a prick? But they are so cheap compared to waiting for us to get diseases, then spending money on the doctors, spending money on the hospitals, spending money on more reports, spending money on medications, sometimes lifelong medications. All this can be avoided when we just do regular tests and take care of things that can be taken care of right away. And the other reason people avoid tests is that they really don't want to know. Now, I know patients who have got better and got amazing results, but then a stress comes in the way or something happens and we slip. Say we're not eating right, we're eating out too often, maybe we're drinking alcohol. And that's the time when we don't want to do our test because we don't want to know the results at that time. Please, if you're slipping, that's the time to do the test. The test will motivate you to get back online because you will see that you slipped even through the test. And it could be that you need to get on medications because you're slipping. So when you're slipping, that's the time we should never miss out on the test. Now, I want to ask you, where are you right now? Just to get to know you a bit, where are you right now in this whole thing? So I'm going to run a poll for you. And here we have, are you new to SHARAN lifestyle? Or you started following SHARAN lifestyle but yet to do the test? You're following the lifestyle and you've done the test. Can you see the poll? Can everyone see the poll? Yes, okay. You're following the lifestyle and you've done tests before and after and you've seen the improvement, or you're following the lifestyle, you've done tests before and after, but you yet have to see improvement. So please vote in wherever you are on this so that I know exactly where we are. Okay, great. So for those of you who are new to SHARAN lifestyle, I want to, and I want you to see the results as well. Okay, so can you see the results of what you have just voted? Wonderful. So if you haven't done all the tests, I want to encourage you to do the test. So if you're new to SHARAN lifestyle, I want to say that I can't promise that we'll discuss all of this today. Today's topic is only tests. If you started following the lifestyle, but you have yet to do the test, I hope to motivate you to do the test. And for those of you who've done the test, we will learn more about it today. So let's go back into the webinar. Also, I want to ask you one more thing before we go there. Do you have your reports with you now? You can wonderful. So many of you have your reports, so you can refer to them while we're talking. Wonderful. Okay, and all of you can see what's happening here, right? So you all know where we are today. Great. Okay, we're going to stop this polling and we're going to get back to the webinar. Okay. Can you see my slides now? Today's agenda is basic blood tests and what they mean. What should we do if the tests are abnormal? And how often should we do the test reports? We are going to cover this today. So I want you to take a look at your test, and I want to tell you that you will see in your test reports your own values as well as the reference values. What is considered normal or average amongst most people? And I want to say that today, for the most part, I will not be talking about numbers. And the reason is because I will do some numbers in the end, but the reason is because there are so many different units of measuring. Just like some people measure their weight in pounds and other people measure their weight in kilos, the same way tests are measured with different reference units. And so if we put the numbers, it will become much more confusing. Now, the mandatory tests that SHARAN recommends are these: CBC, ESR, Lipid Profile, liver function test, kidney function test, thyroid profile, vitamins B12 and D, and homocysteine. And This list of tests is given in our consultation page. So if ever you want to refer to which test should you do just as a routine, you go to our consultation page and you will get this list of tests. Now, doctors often recommend other tests as well, and these are dependent on specific illnesses. So this list of tests that we have gives you an overall view of the body. It checks the blood, it checks the fat levels, it checks the kidney, liver, the thyroid. Overall functions have all been checked here. Now, tests that SHARAN does not recommend as a routine are invasive tests, like tests where they do a biopsy or take out some part of your body or put in a probe, because these all cause injury and they should only be done when absolutely required. Injection of dyes, like an angiogram, for example. You have to inject a dye in. Barium needle, you have to inject a dye in. And these dyes are chemicals that we want to avoid unless the test is more important. And too many x-rays. For example, we don't recommend a mammogram every year to women. And that's because these are too many unnecessary x-rays which have their own harmful effects. Now, how do tests help us? They look at the overview of the body functioning and can give us an indication as to where the problems are. And of course, they let us know if there are problems. They help us reducing medications. Because if you are on SHARAN lifestyle, you know that you're getting better and better. And if you're on medications, it's good to reduce the medications as you get better. It gives us, doctors, a guideline as to whether our guidelines are being followed. For example, if you are on SHARAN lifestyle and you've done the test again after 3 months, the tests must improve. If the tests don't improve, it means that you're not on SHARAN lifestyle properly, and we can look into where the problems are, because we always get results. And it also shows whether we need supplements. So once again, the mandatory tests that SHARAN recommends are these, and we are going to now look at them one by one. Complete blood count. CBC, or complete blood count, shows the different elements of the blood. It shows the white blood cells, it shows the red blood cells, it shows the hemoglobin and the platelets. So let's have a look at these one by one. Now, if you have your test reports, you can actually look at your test reports and see whether your white blood cells, red blood cells, hemoglobin or platelets are in the normal range. So first, white blood cells, and there are several types of white blood cells, the lymphocytes. And the lymphocytes are those that indicate chronic infection. If lymphocytes are high, it could mean there's some kind of chronic infection going on. The neutrophils, on the other hand, indicate an acute infection. Whenever we have an acute infection, the neutrophil levels go very high. And you are able to check this by looking at the reference levels. And then there are the monocytes and the basophils. And we are not going to go into these too much right now, because most of you will not have problems here. And then there are the eosinophils. And if the eosinophils are high, it indicates either a parasitic infection like worms, or it indicates an allergy. So when a doctor looks at the white blood cell count, the doctor knows what kind of problem to look for. Are you with me here? Are you all able to hear me? Wonderful. Thank you. Now we're going to go into the red blood cells, and red blood cells are the cells which carry energy to the different parts of the body through glucose, and they also carry oxygen all over the body. So we look at the red blood cells and we also look at the hemoglobin. And the hemoglobin levels tell us whether the red blood cells are doing their work or not. So red blood cells, there are lots of indications under red blood cells, and these are especially for a doctor to figure out, in case you have a kind of anemia, what kind of anemia it is. So, there are all kinds of anemias, sickle cell anemia, thalassemia. These are out of this webinar. We won't be able to discuss them here, but what we will be able to discuss is if hemoglobin is low. If it's high, very good. If it's low, it could be because of lack of iron. It could be because of lack of vitamins B12 and C. It could be because of lack of folic acid, or it could be because of some specific congenital anemia. Now, if it's because of lack of iron, the doctor will actually have to figure out what this could be. But if you're on a whole plant-based diet that SHARAN recommends, lack of iron should not be happening. Lack of folic acid or vitamin C should not be happening. Vitamin C you can get just by 1 lime a day. Folic acid you can get by green leafy vegetables. Folates come from green leaves. Vitamin B12, and we are going to check for that later on. Vitamin B12 deficiency can also cause hemoglobin being low. And so, if vitamin B12 is low, we must supplement. Okay, so you're all looking at your hemoglobin level and you know whether your hemoglobin is low or normal. Now, platelets. And platelets in most of us will not be abnormal, but platelets are the factors which cause clotting, and they are needed because if you get an injury and your platelets are low, then you'll be bleeding without clotting. But when you get an injury and the platelets are exposed to the oxygen, then the platelets initiate a clotting reaction so that your bleeding stops. And platelets can be low in some diseases, like for example, dengue fever. In dengue fever, platelets become low and bleeding happens internally as well as externally. Then there's the erythrocyte sedimentation rate, or ESR. And ESR shows the amount of how quickly the red blood cells sediment and separate from the plasma. You can see this in the illustration. And if the erythrocyte sedimentation rate is high, that means if it takes a long time, then I just want to say that I cannot look at any one person's reports. You will have to look at your reports by yourselves here in this webinar because there are too many people. Reports also, as we said before, can only be checked in conjunction with symptoms. So I can't even tell you what to do over here. Okay? I'm just telling you what they mean. To get more information, we would need a consultation. Now, erythrocyte sedimentation rate, if it's high, shows some kind of infection or some kind of abnormality. So it could even be high in, for example, cancer, but it could even be high in rheumatoid arthritis. It could even be high in a cold or a cough or a fever. So ESR just gives us an indication that something is wrong. Then there's the lipid profile, and here we see cholesterol. And many of you know that the cholesterol levels could be high, yet it's not a danger, or they could be low and yet we could be in danger. So cholesterol isn't really a good indicator. But cholesterol only comes from animal products. Animal products means meat, fish, chicken, eggs, and milk. Vegetarians and non-vegetarians can have high cholesterol levels because we are all consuming animal products, but cholesterol is never made by plants, not even cashews or coconut. And so if we are on a whole plant-based SHARAN diet, eventually the cholesterol comes down. Now, it might take a long time to come down, and it might even go up because the cholesterol which is lining the arteries gets dissolved, and this is only good. Cholesterol has been accumulating for the entire lifetime, and now it's starting to come out, and this is good. But so just to go back, cholesterol is not a good indicator of how ill we are, but it's an indicator. And then we have the HDL and the LDL, the good cholesterol and the bad cholesterol. The HDL is the good cholesterol, the LDL is the bad cholesterol. And we won't get into this just now. Then there's the triglycerides, and triglyceride levels can rise if we're having too much sugar in any form or too much fat in any form. And so it's an indicator of what we're doing wrong. So look at your cholesterol and triglyceride levels, and if they're not normal, we can get them to get normal just by a whole plant-based diet. Then there are the liver function tests. And the function of the liver is to break down our food into usable portions that our body can use. For example, breaking down the fats into lipids that can be used, or breaking down the proteins, or even breaking down chemicals. Every time you eat food that's not organic and covered with poison, the liver is under stress because it has to break down these poisons and eliminate them. Every time we have chemicals through packaged food in our diet, it's the liver that has to handle them. And so there are liver function tests like SGOT, SGPT, and GGT, which could be high, which only means that the liver is under stress. They can also be high in jaundice. They can also be high if we're consuming alcohol, or if we have fatty liver due to medicines. For example, many diabetics take metformin, and this causes fatty liver, and the liver function tests get bad. Now, this is very, very important because, without a liver, we cannot live. Just like without a heart, we cannot live. The liver is as important as the heart. And we have a large liver as compared to a heart. If something goes wrong with the heart, we cannot function. But the liver is large. And even if a portion of it is working, we are okay. So we really need to take care to keep our liver in control. And then there's the bilirubin levels. And bilirubin can be direct or indirect bilirubin, and we won't go into that. But if bilirubin levels are high, it shows that we have some kind of jaundice. So a doctor can interpret these results and tell you what is wrong with you. Alkaline phosphatase can be high if vitamin D levels are low. So what a doctor will do is interpret these results in conjunction with the symptoms and tell you what you need to do. What you can do right now, though, if you want to heal the liver, is be on a completely SHARAN lifestyle and diet, a whole plant-based organic diet, and a lifestyle which we'll be talking about a little later. The kidneys are an organ of excretion, and the kidney's job is to excrete anything that the body doesn't need anymore. And today we are consuming excess of protein. I do know that a lot of people try to take more protein by taking protein powders, etc., etc. But the truth is that nobody has protein deficiency. We have excess protein. And we definitely have excess animal protein when we are consuming a regular diet that other people consume. And so when we have too much protein, BUN, creatinine, or uric acid can be high. You know, animal protein is a toxin to the kidneys. And today we have more and more people at younger ages with kidney disease. Kidney disease happens because of high blood pressure, happens because of diabetes, and it also happens because of overconsumption of protein. Today, lots of young men and even women are going to gyms and they have people telling them that they should have more protein and egg whites. And honestly, this is not true. This destroys kidneys. So we need to reduce our animal protein consumption, and SHARAN advises zero animal protein consumption. And I want to say that, you know, with so many kidney problems, we can actually help reverse kidney disease by going on a SHARAN diet. Then there's a thyroid profile, and this looks into the functioning of the thyroid gland. And today we know that, you know, there are many hormone problems. Thyroid is a hormone problem, and we have hypothyroid, very common these days. But diabetes is also a hormonal problem. And so is polycystic ovarian, and so is breast cancer and prostate cancer and infertility. And we are seeing so much of all of these today because of hormone disruptors in our life. Chemicals are hormone disruptors. And we can actually reverse thyroid disease, especially hypothyroid, through a SHARAN diet. What we recommend, a whole plant-based diet, a whole plant-based organic diet, I should say. And when you're on this diet, you will find that TSH begins to climb down. And this we can only see through repeated tests. I recommend for people who are on thyroid medicine and who are doing a SHARAN lifestyle to test every 3 months, because when the TSH level goes low, we can reduce the thyroxine intake. And then there's the homocysteine. And homocysteine accumulates in the blood and can cause blockages or clogging. It can cause heart disease and stroke. And so it's really important to check the homocysteine levels. And homocysteine should not be high, but it can be high when vitamin B12 is low. And that brings us to the importance of vitamin B12. Now, as I said, I didn't put numbers into this, and the reason for that is because everyone checks the levels in different units. But I did put it in vitamin B12 because vitamin B12 is so very important. So, depending on how it has been checked, you will see the normal values. And in the Indian system, which is 211 to 911 pg by ml, the levels that I recommend are around 400. So in any system, let us try to keep our levels in the middle of the reference range. If vitamin B12, which is only produced by bacteria, is low, we have so many health problems. Straight from anemia, which we already discussed, to heart disease, which we already discussed, neuropathies, lack of memory, feeling weakness, acidity, losing weight, all this can come because of lack of vitamin B12. So please always get your vitamin B12 levels checked. I can't emphasize this more Even if you're completely healthy, and even if you're a young child, vitamin B12 levels should be checked. Vitamin D is similar to vitamin B12, very, very important. No matter who checks their vitamin B12 and D levels, they can be low, no matter where you live and who you are. So it's really important to get these levels checked. And here too, I've written the ranges because it's so important, but here you can see again that numbers can be quite different. So in the Indian ranges, they should be above 30. At the same time, we can't take vitamin D consistently because excess vitamin D can also cause problems. So it's always good to take the advice of a doctor on how to take vitamin D. On the other hand, vitamin B12 supplement can be done for our entire life. And in a low dose, entire life is always good. Now, hemoglobin A1C is specially for diabetics. If your hemoglobin A1C is over 6 as a percentage, or you can see other numbers depending on how they are checked in your country and in your reports, hemoglobin A1C should always be normal. And when hemoglobin A1C is high, it means we have pre-diabetes or diabetes, or even that we have diabetes but our blood sugar isn't under control. Very, very important indicator today. And if you have diabetes, it's also good to check your blood sugar with the use of a glucometer regularly. Blood pressure is very important to get checked, and luckily this is universal all over the world, so we don't have different numbers. Normal blood pressure is 120/80. Acceptable blood pressures are anywhere between 130 and 140 and 90 to 95. These are acceptable. They're not ideal. But if you aren't on medication and you are in the acceptable range, it's okay. So our goal is to get off medication as soon as we can to protect our liver and our kidneys. Because if the liver and kidneys fail, we cannot survive. And so we want to change our diet to the very best diet, which is a whole plant-based organic diet, which protects liver, which protects kidneys, which can get all your values back to normal. Now, what can you do to get those blood tests to normal? You can go on a whole plant-based organic food. You can go on SHARAN, healthy lifestyle, and let me briefly tell you what this is. This means that rest at the right time, going to bed before or by 10 o'clock, waking up early, eating 3 meals a day, not snacking all through the day, plenty of water, plenty of fresh air, exposure to sunshine. Of course, the food that we recommend, supplements of vitamin B12 and D, learning more about how to be healthy. And I highly recommend our website. Go to Try Vegan and read. Many of your questions will be answered there. If you have low BP or if you have low values for some of these, it's not harmful. It's the high values that are usually harmful, except hemoglobin or blood cells, which could be harmful if they are low. I'm just responding to some of the questions that have been coming. And take the help of doctors to reduce your medications. Be on the minimum medications that are good for you, not the maximum. Imagine if you aren't eating animal products, you never need cholesterol medications. Imagine if you're on a whole plant-based diet, you never need blood thinners. So all this can be done by doing the test. And how often should we do the test? We should do the test every 3 months if we're reducing medications, because we don't want to reduce medications too fast, and we also don't want to not reduce medications if they can be reduced. Then, if you've had low vitamin B12 and D levels and you're supplementing, then I suggest every 6 months until you reach a level where you know exactly how much B12 to take and how much D to take lifelong. If you take these uninterrupted, or if you're completely healthy, then you should check once a year. Now, once a year is the minimum required in this day and age. But if you live totally connected to your body, and if you are listening to your body all the time, and if you're taking regular vitamin B12 and D supplements, according to your need, which I don't know and your test will show, then you can do the test less often, maybe once in 2 years. But I do want to say that a blood test is non-invasive. It does not cause any harm. It's the very best insurance that you can do. And it's the cheapest insurance as well. So once a year is not too much. So the very best insurance is correct diet, healthy lifestyle, regular tests, supplements as needed. Okay? Now, we are going to go into a question session, but I do want to quickly show you that 1 minute YouTube that some of you may have missed with that I showed in the beginning, which is in another language, but you don't need to know the language. You just need to look at the images. And the images are of, you know, us when we're growing up and throughout the years. The choices that we make today make such a difference in our life in the end. So I'm going to show this video once again. And now I'm playing the video very soon. So please tell me if you can hear it. Can you see the video?
Vão ser seus últimos 10 anos. Você será rápido o suficiente para brincar de pega-pega com o seu neto? Forte o suficiente para acolher cada momento? Você envelhecerá com saúde?
Please focus only on the picture.
Ou envelhecerá com doenças? Agora é a hora de escolher. Como você envelhecerá? Como serão seus últimos anos de vida?
Okay, I am going to give you the link of the video here. Okay, so you can see it. Now don't worry if you didn't see the video, you only lost 1 minute and not much at all. Okay, now I'm going to open for questions. Okay, so, just let me summarize once. It's extremely important to do all the regular tests, And if for children, at least vitamin B12 and D, it's necessary at every age. It's vital to take early action if something is wrong in the test. Organic, whole, plant-based diet can reverse many of the common lifestyle diseases today. Medicines are a load on the liver and kidneys, so it's best to change the lifestyle and get off medicines to get well quickly. Vitamin B12 and D need lifelong supplementation, and it's a very small price to pay for the high level of health you can gain by taking vitamin B12 and D. Okay, now we go into questions. And Reina has already passed me someone's question that, okay, I'm going to try to go to all these questions one by one, and I'm going backwards now. How to check vitamin D in toddlers? By a blood test. The pathologist knows how to get blood from even an infant or a newborn. If you have low blood pressure, there's nothing that you need to do, but you will not have symptoms of low blood pressure if you are on a SHARAN lifestyle. The symptoms always go away. Low uric acid levels are not of concern. If you give me your test reports, I can comment only with your patient data form, and this can be done only with consultations. I cannot see anyone's test reports one by one, and I do not ever give comments just with test reports. Never. And no doctor should. That's a bad practice. Are Ayurvedic medicines better than allopathic? No. Ayurvedic medicines can be extremely harmful to the liver and kidneys, and today they contain many heavy metals. High levels of alkaline phosphatase, SGOT, SGPT, GGTP need to be looked into, and I can advise this one by one only by consultations. Okay? So how to do it, because I told you that they have to be correlated with symptoms. This is out of the scope of this webinar. Okay, I'm going back to earlier questions now. We are only going to talk about tests today, so I can't answer questions that have nothing to do with the test. Okay, because I want this webinar to be good for everybody. So there was one question that Reina had sent me earlier. Okay, there's a question, any success on Sjogren's syndrome? And Deepa, I've been answering this to you all my life. But yes, Sjogren's syndrome can be reversed and it takes a long time. And other symptoms also can be reversed like fibromas and all. But how to do this is out of the scope of this webinar. Here's a question. I've been following SHARAN lifestyle and eating organic as much as I can and reduced all my medicines but saw a slowdown or a plateau. Okay. See, I want to say that when we go on the lifestyle, the body heaves a sigh of relief because you're no longer throwing in all kinds of chemicals and processed foods and even refined foods. You're not throwing all these things into your body where they shouldn't be. You're not putting animal products when your body needs plant foods only. And so the body heaves a sigh of relief and automatically your tests become better. But it takes some time for complete healing to take place. And so we all reach a plateau until the healing takes place. Let me give you a simple example of diabetes. If you stop putting the wrong things in your body, your blood sugar levels start coming down immediately. But it takes time for the pancreas to heal. So a time comes when we reach a plateau and then healing takes place. So if your vitamin B12 and D levels are not normal according to the reference levels in your report, you need to take supplementation. How to take supplementation, I can only guide you when I know the whole situation. And so this would require consultations, but yeah, actually this will require consultation because I'll be responsible if I guide wrongly. Excess vitamin D can cause harm, so I don't want to guide wrongly. But any doctor can guide you on this. Okay. So I'm just trying to go back to other questions. I turned vegan about a year back, but my hemoglobin A1C is still 10 plus. Where am I going wrong? And here's the answer. We are not vegan. We are whole, plant-based and organic. Now, how to do this exactly? This is what we explain in all our programs. How to do oil-free food. How to eat according to what your body asks. How to do mindful eating. These are so many things that we could do one by one in all different webinars. But you can get information on all of this and get on track by one of our seminars. Now, it is my hope that I start doing seminars on, on the webinar platform too. And this is going to take some time, but we will get there. So if you're not where we are, remember that so much information has been put on the SHARAN website. And we are always giving information on SHARAN Facebook page, on my personal Facebook page. So please, just start improving and try to improve one step at a time every week, more and more, and everybody will get there. I promise you, in our 21-day program, we see results in 100% of the people. So why will you not get the results? However, there are people who come to our 21-day program and fall off the wagon. And there are people who come to our one-day program and never fall off the wagon. So what you get totally depends on you, and you can get the results to the very best extent if you decide to. Okay. Now, how do you check if the medicines that you're taking is vegan? You need to ask the manufacturer of the medicines. Lemon, which is very good for health and alkaline, gives me body aches. Sour fruits cause problems. So here's what I can tell you. That, we can't do things one at a time. Our body is responding to us because it's telling us what we shouldn't do. So if you get symptoms by taking lemon, never take lemon. But why you're getting symptoms from taking lemon when lemon is so good for vitamin C? That someone would have to probe into and find out the real cause. So the way we heal in SHARAN is to understand the cause and remove it. We never only work at the level of symptoms. We always work at the level of cause. And that's why I told you when we were discussing hemoglobin, what could be the cause? That's why I told you when we were discussing liver, what would be the cause? That's why I told you even in the thyroid or the kidney, what are the causes? And if we start removing the causes, we will get well. Tell me, have I missed any questions? Because if I have missed questions about tests, then you can ask me these right now once again. I would really appreciate that because so many questions have come in, I can't see them all. So once again, low blood pressure doesn't really matter. But you will not have problems if you're on a whole plant-based diet. You will not have all the problems that you are mentioning, like snacking so many times a day. My own blood pressure is low, and low blood pressure is good. But I don't do all the wrong things that you might be doing that you're mentioning in your question. Darshana, thank you for letting me know that this made a difference. The seminar made a difference. I do believe, and that's what keeps me doing the seminars. I do believe that the seminar makes a difference wherever you are. You know, because there are so many things discussed in the seminar that we can't get them all at once, but every improvement is good. And that's why we have a special repeaters rate. And so many people come back again and again for the seminars just because we can, you know, you can learn more every time. When you reach a plateau, learn more. And remember, for those of you who are far, if you're in Paris and everywhere else, please, our website has so much information. You can go to our publication section, which is under About Us, and our publications are free there, down for download as PDF. So we have so much information that at least you can begin to get online and then come to a webinar, a seminar, whatever, to get all the way there. Any other questions? Okay, I'm looking. It is told by my doctor to avoid corn in high uric acid case. Is this true? Honestly, no, this is not true. What you need to avoid if you have high uric acid is high protein, especially animal protein. Okay. My B12, okay, I'm not answering numbers and exactly this because I cannot. As I said right in the beginning with my very first slide, I cannot answer questions without knowing the whole amount. But if your B12 level is low, you must be on supplements. If after taking supplements, oral supplements, and I just want to say that the supplements should be methylcobalamin and not cyanocobalamin. If your B12 levels are low, take methylcobalamin tablets. If they don't rise, take injections. Take these according to the advice of your doctor. Trust me, every single doctor is giving vitamin B12 injections these days. So everyone knows how to do it, and you don't have to depend on me. Glucose tolerance test is not mentioned here because glucose tolerance test is only for diabetics. However, here's what I suggest. Why would you pollute your body with a whole lot of glucose even on one day? So we can actually do it another way by just hemoglobin A1C. And a normal person has a hemoglobin A1C much below the borderline level. So you will already know from this that you are free. So once again, I'm not answering the questions of vitamin B12 and D because I've answered that several times in this. And yes, looking at the questions, I just want to say that in my 21-day program, when I check everyone either has a vitamin B12 and D deficiency, or let me put it this way, 90% of the people have vitamin B12 and D deficiency unless they are on supplementation. Today, more and more people are on supplementation. Very few people don't have the deficiency and are not on supplementation. So it's really essential to check this. If you get only one thing out of this webinar, and that is to check the vitamin B12 and D, then please, this is worth the webinar. How do you gain weight on a SHARAN diet? On a SHARAN diet, you will automatically get to your best weight for your health, for your height. You will get to the best weight, but it takes time. First, cleansing happens and you do lose weight. Now, I don't want to argue with your doctor who said this is not too low and this is not too high. I'm only telling you what I've experienced with thousands and thousands of patients and thousands of test reports. My uric acid was on the higher side and I was on medication, and it was since January I am on a SHARAN diet, but my uric acid is 7 without medication. Is it okay? Yes, it is. You will know that your uric acid is okay because your body, remember I said we have to correlate with symptoms, and your body will tell you, because now you're not getting gout or pains anymore. So symptoms always take precedence over report, always. My D levels have increased by 10 units in a month's time without supplements, and I've heard that D3 generally takes time to increase. Is it true? Yes, the D3 generally takes time to increase, but some increase takes place right away. And so, thank you. It's good, Alpana, that you have done the test. Okay, so Susan, you're talking about so many things that are high and low, and so I can't recommend this without the symptoms, as I said before. And so I highly, highly recommend that if you have problems, go to your doctor. Your doctor will correlate the symptoms with the test. The test cannot be judged alone. We are coming to the end of this webinar, and I want to thank you for attending. Please, if your questions have not been answered, it's only because I cannot answer them without the symptoms, and I'm willing to answer them, but this requires a consultation. Remember that these consultations can be done with your doctor or with our doctors. Any doctor can do these consultations for you. Is it possible to cure tinnitus with a whole plant-based diet? Yes, in most cases, and it takes time. I'm going to stop the recording now.